Hey guys, welcome to Respiratory 2140 lab videos. This video is going to be all about manual CPT and the high frequency chest wall oscillation. This is Trenton. He is a respiratory therapist and former model for the Dumpke College of Health Professions. He is volunteered to be my patient today. So indications for CPT, so chest physical therapy, include consolidation of secretions, increased aeration. Such patients you would use this on would be cystic fibrosis patients, donor patients, and patients with overwhelming pneumonia, atelectasis, consolidation, where we need to be able to break up those secretions so we can mobilize them up and out of the lungs. So with any procedure, make sure you wash your hands, gather your equipment, identify your patient, check your orders, and make sure you have the right patient and do your pre and post assessment. Remember, Heidi and I are really big on assessment. So first we're going to show manual CPT. Some indications again are secretion mobilization, breaking apart, consolidation in the lungs. I've mostly performed this in my experience on cystic fibrosis patients. You don't want to make sure you don't go over any hard bony areas, any areas with damage, burns, and trouble with this areas where there might be skin irritation. You also want to make sure you have a thin piece of fabric over top so that you're not just having direct skin-to-skin contact with your patient. So for example, you want to make sure your hands are cupped in cupping position and that your wrists stay loose because you're trying to get a cupping pop while you're doing CPT over area there might be consolidation. So as you can hear, there are some popping. And you would continue to do that for 20 minutes, specifically over areas of consolidation. With patient positioning, you want to make sure that that area with lots of secretions and that you're trying to mobilize is up so that we can work on draining to get it out. Okay. Any input?
Just if you're working on a lateral portion of like a middle lobe, the patient would be laying down, postural drainage. So the different, you'll learn about that you'll have that on as test questions, but you wouldn't hit the sides of their lungs while they sit up because that would drain it down into the basilar portions of their lungs.
Yep.
You'd lay them down flat to do that. Where she was focusing on the upper sections, that brings it down towards the main stem bronchi where it can mobilize and come up.
And we'll have a whole video on patient positioning and including Fowlers, semi-Fowlers, and best for drainage. Another product of equipment that's used is the vest. So there are two types of vest you will use. We have the kind that we use mostly for our cystic fibrosis or patients that are ambulatory. You will fit this this is a large, so you'll put it on and you'll want to make sure that there is a fist distance between the patient's chest and the outside of the vest. The patient put on their vest. Oh man, I have to backwards. We put it on, and then we make sure that he's able to stick a fist distance between himself and the vest. That's how you fit it. You will see down here, these are all with Velcro. You want to make sure nothing's going to rub, cause any type of skin irritation. We have these ports right here. They're a little hard to see. So this is the machine used for high frequency chest wall oscillation. You plug it into electricity, it's run by electricity. We have our two tubes that attach the machine here and here. We have a balloon where patients can start and stop the treatment as they need it. And then these tubes attach to the opening on the vest. They fit right in. You want to make sure they are snug because it is going to take a little bit of work. To turn the machine on, you plug it in, press on. It will come up with normal and custom. The normal setting runs for 20 minutes. The custom setting also starts for 20 minutes, but depending on the cystic fibrosis clinic or the hospital's protocols, it will have breaks for a patient to do huff cough, which we will talk about in a different video. So for this situation, we're going to do normal. And we can see the hertz, which is the frequency. So it will oscillate 13 hertz, so 13 times 60. And then the amplitude, or how aggressive it is, and then the length of time. So you press on to inflate. As we can see, it begins to inflate and fill the vest with air. And once we are ready to begin our therapy, we press on. And we can begin oscillation of the chest wall. So we'll pause that. You can pause it, resume it if your patient needs a break for some reason. And then once it's done, make sure your patient is a good, clean, safe position. Help them with coughing, monitor their vital signs, and just continuously monitor your patient for the whole 20 minutes. The last thing I'm going to say is there are certain vests that are long that just wrap around the patient's chest that is often used in ICU situations if a patient is tolerating it or it's indicated. You can also slide it underneath the draw sheet if you have a patient with chest tubes. Most of the time chest tubes are a contraindication, but if you have a patient such as a lung transplant, you might slide it underneath the patient in order to keep those secretions mobilized. So that is CPT and the vest. Come to class with questions. We'll have you guys practice on each other, and it'll be great. Okay, we'll see you guys in lab.